This will be a guided video to help strengthen your knee. Very useful if you have knee pain, arthritis in the knee, if you've just had a knee replacement, and if you're just looking to strengthen your knee due to a certain injury recently. This is the video for you. All you need is a bed where we can dangle your legs off to start, or a sofa or a chair, and then a towel for the first exercise. So if you need to pause the video, go for it. If you're good to go, if you saw the description, then we shall begin. So all we want to think about first is letting the legs dangle, and we're just bringing some gentle mobility. So the goal of this first one, just kicking the legs out like this, is simply circulation. So instead of straight into strength, let's just work on circulation, bring in some blood flow, water flow. And we can do that just in a real gentle way, letting the leg be fully relaxed. So you're not tensing anything, you're not making this too aggressive, we're just letting the legs swing. And try to relax the feet as well, if there's enough room. Keeping your posture up. And now we can work tiny circles like this. Real gentle circles. So not going too wide. Try to do both at the same time. Again, the goal, circulation. Nothing too intense. Okay, now spin the circle the other way around, so we're coming away. That's it. So hopefully what you're feeling in your feet is a bit more warmth, a bit more activation. And if the circles are too much, then just reduce the range of the circle. Okay, good. Now, if you can place your feet on the floor, what we'll do one at a time, and this is just what I call a squeeze and release technique. So if you can position yourself where your feet are on the ground, you're supported, you're stable, you're grabbing your hands, and all we're doing here is just squeezing, releasing, squeezing, releasing. So we're squeezing all around the knee. So if you want to start, we'll start with the thigh, so the top of the thigh here. I'm not going to tell you where, just start squeezing with me and releasing. So this is soft tissue work, kind of like a self-massage. Then we can go to the side, down towards the inner thigh. Again, it's just a squeeze, then we release. Nothing too intense, but again, really good and powerful to just help with circulation. And really get down to the side towards where the knee inserts here. That's always a good area. And then just, maybe on the knee itself, you're just gently rolling around it. Okay, good. Now we'll go to the other side. So think of this as our little warm-up. So start again, we squeeze, release, top of the thigh, squeeze, release. I like to use the thumbs, but it really does depend on you. If you've got arthritis in your hand, you could just work whatever feels good. So just now come to the inside, a neglected area, but really good area to release. Good. If you find a tight spot as well, really stick on that point, because you can release a lot of adhesions and soft tissue, which is really good to get the blood flow, the water flow around a tissue. And then again, just on the knee itself, all I like to do is just scrunch up the skin. I don't like to press the knee, just like to kind of like scrunch the skin like that. Okay. So that's the first little stage, and now we work to the bed. If you want to get basically you want to get onto a position where we can bring our legs up, and this is where we will use the towel. So I'm just going to cut the video, and we will start the first strengthening move with heel sliding. So the first strengthening move, like I said, is heel sliding. We want to relax one leg and bring one heel up off the ground. Now don't bring it into the point where you're trying to force the leg in. For me, it would be here. So when you find that sweet spot of, okay, if I go any more, it's me forcing it. Once you found that spot, that's the range you work to. So from that point, we heel slide. So you slide on the heel, ideally with socks, because then your feet can glide. Then at the end point, just watch my right leg here. I squeeze here, gentle squeeze, nothing too intense. Then we slide back to the end point. Squeeze, and then we keep that flow. So we'll just do 8 reps, 1 round. I'll do 1 round of each today, just so you get an idea. Ready? Let's do it. So bring your leg up first. Position yourself. 3, 2, and 1. So heel up, and I'll start sliding. Gentle squeeze at the end point. 1. So this is helping with range of motion at the knee, also circulation, and you will start to feel the knee itself actually, which is what we want. We want to feel like it's working. 2. Keep breathing as well. 3. To the end point, no more. 4. 5. And it doesn't matter what side you're starting on because we will do both sides just to keep things balanced. 6. So hopefully you're starting to feel around here, just fire up, especially the thighs, so the muscle above the knee there. 7. Let's do 1 more. 8. Brilliant. Okay, now we go to the other side. Relax the leg you just worked. To the end point with the other leg, heel up. Now start sliding. Squeezing. Gently releasing. 2. Again, if you feel pain, then you want to work in the ranges you don't feel pain. So maybe don't kick the leg out as far or don't bring it in as far. 4. 4 more. 5. 6. 7. Then last one. 8. Brilliant. Okay, so I want to use the towel because between each one, I actually want to give it a little self massage. And you know, if you to use a towel because it can be quite rough surface. It's a really nice way to just press an area to feel like there's like a massage. It's kind of like a massage using a nice surface. So that's what we're doing here. It's just between each set, we're just going to do what we did at the start. It's just gently press and release using the towel, crunching up the towel. Just gently pressing and releasing around that area and then onto the knee itself. So the towel feels it's almost a little bit rough on the skin, but it's really nice. You know, at the end of a massage, they use a towel, right? And it's just a really nice feeling for your skin and for your soft tissues. That's what we'll do between each set, okay? So that's good. It was one side. Other side. Wrap the towel. And again, this is up to you. Wherever feels good, we're just squeezing around. Get to the sides as well around the IT band. And then just use the towel. Just maneuver around the knee there. Again with this, circulation, soft tissue. I think your knees are going to feel great after this. Okay, brilliant. Now what we want to do is towel can stay away for now, place one of your pillows and just place it under the knee like this. So we'll do one leg at a time. The next one is called a short arc. So notice how I'm in a shortened position. This is known as a shorter lever. And all we want to think about is Maybe leave the pillow about just at the calf level. All we want to think about is, in this short arc position, we kick the leg like this and squeeze the knee, then we release. And it always stays in this short arc position. So here, like so. So this is knee extension where we're pushing the knee back against the pillow. All right, so once again, 8 repetitions. And if you do these on your own, you could always do more than 8 and do 2, 3 sets. 3, 2, 1. So put the pillow there, push the pillow down, bring the toes up, and relax. So get a good squeeze of the thigh. Push the pillow down, toes up, and relax. So the leg does not move, we're just putting it into the knee extension part. Little squeeze, relax. Keep breathing. Let's do 4 more. So this is working the thigh, so the muscle above the knee, which is one of the major stabilizers of your knee joint. 2, let's do 3 more. 3. And 4. Okay, now we'll go to the other side. Just where the calf is. Ready? 3, 2, 1. Press. Relax. Press. Relax. 3, keeping those toes engaged. It's 4, 5, 6, 7. Okay, last one. Ready? Push the pillow, and relax. All right, brilliant. Let's get that towel back out. Just wrapping it around. Squeeze and release. I really find that on the sides is where I feel most pressure. So if you just want to use the towel, pressing like this. Because essentially what we want to look at is all around the knee. When there's inflammation in the knee, arthritis, an injury, there'll be inflammation, not just on the knee, but in surrounding areas. So that's what I'm really looking at here, is just helping release areas above the knee to the side of the knee. Okay, other side. No rules for this one, it's just really you thinking, what feels good for my knee? Where feels like there's tension? Even along the IT band, the hard area outside of the knee. Okay, awesome. All right, pop the towel away. We've got 2 more moves. Now, if we can get a couple of pillows, because we want to prop the leg where there's a bit of a deficit of the bottom half of the leg. So before we were looking at, and by the way, 2 pillows is fine, 2, 3 pillows. We were looking at a short arc where we were pushing the knee down. But now all I want you to think about, instead of pushing the knee down, I want you to think about kicking the foot up. So the knee isn't pushing down, the knee will naturally move down, but this time our focus is kicking up. So it's a different angle that we're looking at. So I want you to be here and we kick the leg. See how this half of the leg now is really high. So we're really working your knee like this. Whereas before we were pushing down, now the focus is lifting up. Okay, so 2 or 3 pillows. And if you want more height, if you want more of a deficit, just grab a couple of more pillows, completely up to you. Ready? Let's do it, you're doing great. 3, 2, 1. So think about kicking up this time. Then let the leg fully relax. So there's more range now. Good. Think about kicking up. Brilliant. 2. Kicking up. 3. So think about your toes coming towards your head. It's 4. 5. Keep breathing. 6. 7. Here's 8. Last one. And 8. Fantastic. Okay, should we bring the pillows to the other knee? Okay, remember, think about kicking up as opposed to pushing down. Ready to do it? 3, 2, 1. So kick up. Dropping down gently. Kick up. Dropping down. Kick up. Dropping down. Kick up. Remember that cue, toes towards the head. Keep breathing, keep breathing. Last 2. Last one. Great work. Drop the pillows. Back to the towel. Just gently press, release all around. I always feel it just see my knee, and then I come inside. That's where I really feel some adhesions and some trigger points. Okay, over the side. We got one more move, then I'll let you go. Little slide of the IT band to finish. Ooh. Okay, cool. So I just need to cut my camera. All I want you to do now is lay flat on your bed. Get a pillow for your head, so you don't want to hike up too much, but just one pillow for your neck. And we're going to do some form of leg raise before we finish off with a little calf squeeze and release. So for this last one, I want you to tuck one leg in, and one leg will be straight. Now this is a long lever, so we're looking at your thigh, and we're looking now more towards your hip flexors as well. And all we're doing is raising the leg and real emphasis on lifting from here. We want to keep the low back still, and then we slow on the way down. Go like this. Okay, so it's just a simple leg raise up and down. We'll do 8 reps. 1 set. 3, 2, just follow my cues, take your time, be really slow with this one. 1, let's go, toes towards you. Don't go too high, do your best, it doesn't matter how high the leg lifts. Slow on the way down. Feel your hip flexors, your legs, your quads work, good. 1. Back up. Think slow, so we're getting some eccentric strengthening of your quad and, not quad and thigh, they're the same things, quad and hip flexor, there we go. 2. 3. Again, don't worry how high they lift, it is a challenging movement, but really good to help strengthen the knee in this long lever position. 4. Up and down, slow on the way down though, that's the emphasis there. 5. Don't mind normal up, but then slow on the way down. Here's 6. Doing good. 2 more. Most intense till last day. Good. And then last one. Awesome. Bring the other leg in, and then relax. The other leg straight. So really working here, strengthening the thigh, the hip flexors. Ready on the other leg. 3, 2, 1. Lift gently, lower slowly. Up. Slow down. 3, 2, 1. Good. Up again. Down slow. 3, 2, 1. Nice. Here's 4. Good. Hopefully you're really feeling the muscle work, the thigh and the hip on this one. That's what we're really going for here. Let's do, this is 6, 3 more. Remember, it's not about how high you lift, it's how slow we go down, the controlling part. 2 more. Oh yeah, last one. All right, good. Whew. Okay, so now slowly up to, where we first started this session, on the edge of the bed. I'm just going to do a little gentle squeeze and release for your calf. Then it's all over. So edge of the bed, just take your time getting up because we can get dizzy and lightheaded. So please just take your time and I'll meet you on the end. So let's look at just gently squeezing and releasing the calves. I was going to use the towel, but let's just use our hands. So we're bringing one leg up, and I'd just like to rest the foot there, as long as your knee's okay. And again, just squeeze, release. Squeeze, release. Obviously we're working below the knee here, but the calves can hold a lot of tension. And if we can release below the kneecap, it's amazing what that can also do. Just really squeeze in. Please position your leg where you feel comfortable and safe. There's no right or wrong way to do this. And then get onto the outer side as well. Okay, good. Now let's go to the other side. It's always around here, the chunk of the thigh, top of the thigh there. There's a lot of pressure in there. But again, we're looking at the body not just in an area of discomfort and pain, but around areas to improve the circulation. So the body doesn't work in isolation. Everything's integrated. So if we're looking around the knee, it can really help the knee. Again, this is just gently massaging. Okay. And release. How are we feeling? Well, I hope that felt good. I hope your knees feel a bit of a release straight away. But this is something to do consistently. I'd say 3-4 times per week. You could probably do these every other day, to be honest, as long as there's no pain. And do come back to this session, but if you were to do this on your own, 2 to 3 sets, 1 to 2 sets would be really, really good. And take your time, but it's a way to build up your knee strength, and reduce inflammation in your knees to help your knees to a much better place. So I really hope that was helpful, and if you wanted to check out another video of mine that's guided, check out this one here, some nighttime gentle, tension and release. It's a Jacobson's muscle relaxation method. So check this one out here, and if you would love to subscribe to my channel, I'll pop my little face there. You click the face, subscribe, and that's it. Hope it helped today.